Yes.
Yeah. Okay, I have 6:30, so let's call the meeting to order of the Sawyer County Health and Human Services. Roll call, please.
Dale Schleter,
Yep.
Marshall Savitsky,
Here.
Jesse Betcher,
Here.
Michael Maestri,
Yeah.
Chris Ross,
Here.
Lorraine Boucher, Don Pettit,
Here.
Carol Pearson, Sabrina Dunlap. You have a quorum.
Thank you. Pledge of allegiance. I pledge allegiance to the flag
of the United States of America,
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Certification of meeting notification.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Okay, has everybody had a chance to look at the agenda? Is there any changes?
I'll make a motion to approve last month's agenda.
Thank
I'll
you.
second that.
And a second. Thank you. Public comments. Do you have anybody from the
We have
public?
to vote on that first, though, Dale.
Oh, thank you. All in favor, say aye.
Aye.
I was thinking that if there's no changes, we don't even need to do anything. I'll get it all right one of these months. But no public comments. Okay, approval of minutes from last month's meeting.
Motion to approve.
Thank you, Deanna. Second,
Second that.
thank you. Everybody in favor, say aye.
Aye.
Okay, thank you. Media reports. Lorraine, you ready?
Yeah, let me give a short report.
Thank you.
I'd like to start off with our health center because I want to keep things updated on where we're at, even though things have slowed down. On one hand, we're still seeing things in the community. So, from the LCO Community Health Center, the health center had 16 COVID-19 positive tests in the previous week, and 7 positive COVID tests in the last week. Symptoms at this time resemble bad colds. We had no influenza infections and no RSV infections in the past week. The tribe has lifted the COVID-19 emergency declaration as of yesterday. So now we have lifted that, and we are expecting our workers to be on site in all departments and to continue to work with whatever, if there's symptoms of anything, and to work to the best of their ability, but continue to form, and they can no longer have administrative leave for that coverage now. So we have made that decision, so we're moving forward now. We have a new nurse practitioner, Angela Hank, who has joined our Kajiki Health Center, the MAP program. She started yesterday, I do believe, or today. At Kajiki, so now she came on board to help us address the addiction that we are seeing in the community. So she's an addiction specialist, with addiction medication and psychologist also. So that'll help all the way around. And the 161 agreement that we have with the county, we have now passed that, signed it, so I'm sure now it's been signed. And we had hired a new person in our elderly center, Sherry Quagan, to the position of elder health advocate, and she will be creating an awareness about long-term support systems and home and community-based services. So she's going out in the community more and engaging more, see what our people need and make sure they get provided with what the help they need. Aging and disability services staff will meet with the ADRC staff to strengthen collaboration efforts. So we are building on that also. Our apartment building that we have, that we're building now is making progress. And it's getting there now. So we will be having housing for, like I said, the workforce for 40 different apartments, so we'll help population there. We've had some events in the community. The last time we met, we forgot to mention that we had a speaker come in the community that went to all the schools. Hayward Public School, Winter Public School, Good Ranger Boys School, St. Francis Catholic School, Boys and Girls Club. Went through the community carrying a strong message. It's the first time that we've had assembly with our students since the pandemic started. That we called them all together to give the message, good choices, staying healthy, and to all walks of life. He was Native American who made it to professional football to play for the Bears and the Vikings. And he travels across the nation to help reach our young people, to give them that strong message for them. But it was good, he went to all of our community.
That's nice. Good.
And Jiggy helped with that, the schools helped with that, tribe helped with that. We all put the effort into that to have him be here with us. And he met with a lot of our kids. So that was very positive. We've had a lot of cultural events tied in with like ice fishing, some fun, some competitive, but also teachings, the teachings. Just again, for cultural teaching, but to keep addressing what we're seeing in the community to offset that and going back to what we want our kids to learn. And we had a round dance, gathering all of our people, not just LCO and other residents to come and be with us, to have those good things and to be around that drum in a good way. We are continuing to work on our university. We're expanding our campus and programming what we're offering for degrees. So we want to keep building on that and offering that to our students. I'll keep you updated on that because we're going through some stuff right now, and we still want to keep working towards our dorms that we want for our students in our area to help meet that population. And then we are continuing to provide the best we can in our shelters with programming and services that our people need the best that we can. So, and with the addictions, trying to help them by getting them treatment and trying to work on the care that they need. So, you want anything?
In our 3 schools, you want to talk about the tracks, the language in the environmental school, and
Go ahead, Ed.
you want to say anything about that? Well, we had a report with our environmental school, and we also have a language immersion school, and then our LCO school. So we actually provide 3 tracks of learning for all of our native tribal kids, and it's working really well. Building students in all the schools, so it's a great environment for our kids.
I think that was it. Thank you.
Thank you. Any questions for Lorraine?
Yes, I do.
I'm sorry.
Responded as a question.
Yeah.
Okay, you have the floor now.
I'd like to find out why families are being placed at the American with children.
I know there's still a homeless issue that we are addressing. And there's a variety of needs that we have. So we're trying to utilize the supports we have in place. But I do know that the need surmounts that, so we try to help them in ways we can.
I guess my question would be, is there no other place to place the children with the families than at a hotel where they're dealing drugs? It's basically a trap house out there, because we're going to have to station a police officer out there and a social service worker if it comes down to it, because there's been a child that was on the roadway walking. They had been evicted from there and then got put to Flat Creek. He was 4 years old. There is a big issue with what's going on there. So I'm trying to figure out, for the constituents of Sawyer County, it's not only tribal members, it's a concerted effort throughout Sawyer County. This is a big issue. The children should not be in that environment whatsoever. That's all I have to say.
Thank you. Okay. Senior Resource Center. Is Joy online?
No, she isn't, but Ed Peters submitted a written report on the meeting, so was just recently attached.
Oh,
And just got logged on as well.
And Ed logged on.
Ed, would you like to elaborate?
Good evening.
Good evening.
Sorry for being late.
You're right on time.
Just wanted to draw attention to the meeting from February 8th, 2023. And that several of us from the Sawyer County Senior Resource Center Board met at the assembly room. And we learned a lot, I think, from Mr. Johnson, and I hope we can proceed with the process of analyzing the information, or at least analyzing the possibility of looking at areas in Sawyer County that may be able to serve the meals or produce the meals that serve our senior citizens more completely.
Okay. Anybody have any questions, concerns?
Yes, I do.
Go ahead, Ms. Pettit.
Mr. Peters, I'm looking at the line, the discussion turned into the possibility of establishing a second kitchen to serve the needs of the southern and southeastern portions of the Sawyer County. About purchasing existing restaurants or leased or purchased and outfitted. The Waldo Center in Winter was outfitted accordingly to that. So I don't understand why that center would not have remained open. Everything was tore out of it. It was a leased building from the Brad's brothers, whose father from Go was leasing that for $300 to the county. And it's on the main highway. It bewilders me. So everybody on the southern end had meals, a facility closed to them, and a private entity has opened it up. And now you're talking about leasing or purchasing, maybe outfitting another. We had that already. I don't understand why it was pulled from the community then.
I can respond to that. We could not find qualified help to run that facility. We looked, we interviewed. We could not find anybody to keep that facility open. We needed a cook and a helper, just not available. And
Oh,
that's,
okay.
and
So if
as
you're
the other-
talking about that, how are you gonna outfit another one then for this area?
well, as it turns out, the information we got from the gentleman from Guar at our get together was that's pretty much not going to happen. Excuse me, Lynn, you have something you wanted to add?
Yeah, just another, I think there's a little bit of a misconception in adding a third kitchen. That's never been the idea. We've been asked to look at consolidating kitchens. For example, maybe combining Exland, Stone Lake, and the southern end into one consolidated kitchen, not adding additional kitchen, because we've been asked to reduce expenses. So that's why we're looking at something maybe perhaps more central in a restaurant that's already equipped for that size, because nothing we have right now is of a size that could hold a consolidated facility, correct?
Right.
And like I was saying, Justin Johnson had a wealth of information, and he talked about all of the places it has been tried, and a couple of places, at least one place it did work, to have a centralized kitchen, but they had everything fall into place at the same time. He said, other than that, everybody has failed and they are not profitable. They are not they're not saving money. They actually cost more money. So that's where we're at with that. Does that answer your question along with what Lynn said, Ms. Pettit?
Yes, sir.
Thank you. Okay. Where are we at here? Administration. Andy, you want to take over?
That's just the monthly list that tells about the services that's in your packet every month. Just for review.
Yeah, maybe I'll just add.
I'm
in-
sorry, I forgot that she was taking over.
Yeah,
I
she'll take
apologize.
over. I just want to add into the administration for the committee's benefit that Paul has given us a retirement commitment to retire at the end of April. So we were starting the process to recruit for a new executive director that finalized the job description this week and we're getting out the posting. So we anticipate having it open through most of March and then do interviews and hopefully have somebody hired before Paul is done at the end of April.
Any questions? Did you want to add anything to that? Okay,
I guess I do, Chairman.
yeah.
Andy, do we have any in-house applicants that might be interested, or we don't know yet, or we're gonna
No,
post
no,
or what?
we're gonna, it'll be an open posting for internal and external candidates to apply. We've not queried around internal to see who might be interested, who's applying. It's my belief that for like an executive director position, we need to make it an open posting and
Sure.
try to find the best applicant, and that's just sharing with somebody today in my mind that even if we have internal applicants, to have them go through that same process so that it's like kind of an open and competitive process that if they do hire internal, that person is the best applicant for the position and has the faith and trust of the employees that are here.
Who's that for?
Paul, Robert's position, the executive director.
You retiring?
Yes.
Mhm.
I have my,
Excuse me.
And April?
Yeah.
You don't have anybody lined up to take his spot?
We're gonna post.
We brought that up a couple of months ago, I thought. Can we do it this year? We had to try to figure out a way to line this up so we didn't fall into this issue of not having somebody. Or
yeah, I brought it up.
Excuse me. Somebody else is talking, so I want you to wait.
Was there anybody that was working on April Paul? Was like an assistant director or anything? Or was he just?
Well, he had his department heads, yes.
Yeah, the unit directors in the department are there. And yeah, Paul talked about last year that he was gonna be retiring this year. It's a matter of getting him to commit to when the retirement was gonna happen. And that's his choice. He could have worked, I don't know, through the rest of the year at his choice, but
Are you expecting anybody else to leave this year? Joe, are you leaving this year?
have
I'm my
not-
go-to guy for law enforcement. We all go to you.
I have not.
Paul's leaving, it's a.
I've not put a notice in yet. I've been contemplating actually maybe leaving on the 28th as long with Paul. I have to give a 30-day notice. However, there are a lot of things going on. And there's no one that knows my job. And in the interim here, and I still got a little bit left in the tank. Unfortunately, I have not been able to. I got in a situation again where I haven't been able to use all my vacation time. And I have made a request into Mr. Alvarado here, if I could carry some of it over past my anniversary date. Otherwise, I'm gonna lose like 5 weeks. So it would be better for me to quit and get paid out than, but there's so many things going on. I feel it's a bad time. And there's no, so I'm awaiting Mr. Alvarado's decision. If I can carry something over till the end of the summer. With that, then I would certainly contemplate staying around, but there are a lot of things going on. And there's no one that knows my job. The court stuff, nothing. I was sick with COVID a week and a half ago. And I tried to take vacation time. And just ended up getting called and called and called. And it's not just the crisis. It's during the day stuff. Duffy Law, it's the hospital, It's all in all. I love what I do. Anybody knows me knows that, you know, but I'm gonna say.
have to change your phone number, right?
But I'm gonna say what I'm gonna say, and I'd have to get a decision on that vacation time, otherwise I think I would contemplate leaving.
Okay, does somebody else have their hand up? Ms. Pettit, you can go ahead now.
And this is the exact scenario that I've been saying for months now, we were setting up for. So now we have Paul leaving, Mr. Bodo leaving. Is there another social worker leaving also? So we have left ourselves short-handed, guys. And we are now have 70 years probably between Paul and Mr. Bodo, and even more with another social worker. And we've left our county completely understaffed, underserved, do not have the resources. And we already have the epidemic with the opiates and the suicides and the fentanyl overdoses, the mental illness, and now we have 2 people stepping down and a third. So I don't know what it's going to take for this county and all of us to wake up to see what is happening here, because it is extremely, as a parent, as a person that has family members that were within the system, that were in need of services from the county, special needs services such as ventures and things like that, and those services for bus services. I am so upset, saddened by the lack of our compassion and empathy for individuals that cannot fight for themselves. Children that are in hotels where drugs are we are putting them there. This is out of control, gentlemen and ladies. I don't know what it's going to take. How many more people have to die? How many more people have to go to the jail, get released, and have nowhere to go? This is beyond okay now. We're losing Paul, Joe goes, and in fact, I would put a motion forth to pay Mr. Bodo whatever he needed to stay on, pay his time that is owed to him to carry it over, because I don't know what we're going to do. We have no one in the pocket to fill his position or Paul's. I'm just done.
Thank you.
Mr. Chairman, I got a question. Andy, are we able to, and can we offer a competitive wage for this position so we can recruit some top-notch people? Or attract someone to actually apply for this job?
Well, we're gonna find that answer out. I mean, based on the wage, based on the wage we're currently paying and the wage range we have established, it's in line with other counties. It's not aligned, but I mean, we're finding out that regardless of where our wages are, you're pulling somebody from somewhere else. So whether we're seeing this with the highway commissioner, is the wage we're paying commensurate with other counties? Yes, I mean, we're not at the top, we're not at the bottom, but getting people to apply or move into the area, or finding somebody local that's qualified could prove difficult as well, even at the wage. So, from here, it sounds like I'm hedging. I am, because you really don't know. It's like fishing. You don't know what you're going to catch until you put your line in the water and see who's willing to have an interest in.
Would there be anybody internally in the Sawyer County system that would be next in line, I guess, for the?
We don't
job,
have,
or is it-
we're not a large enough county to have the luxury of having plan B already waiting in the wings. Do I think there are employees in the human services area that might have an interest or might have the qualifications? It's certainly possible, but I'm not gonna speak up for them. And like I said, I guess my own opinion is, especially for, in some positions where we have maybe, I would say, non-department head, administration people, we kind of have places where it makes sense to move somebody up and then hire for that spot. For a department head position, though, I think you want to make it an open process to internal, external applicants to try to get the best applicant. And you might end up with an internal candidate that is your best applicant. That'd be great, but you have to kind of go through the process to determine that.
Considering the circumstance that the county have the ability just to pay him out on what he's gonna lose, I mean, obviously we can't, I mean, he doesn't.
Yeah, I'll deal with Joe. Separate, I can,
I'm not asking for a payout, just let him carry.
we'll work. I thought Joe was gonna go to Chicago and have a big plate of pasta.
I got cool.
Okay,
But
you were gonna go do that, and then we're gonna talk.
I would just like to say that, can I say one thing? I would just like to say that, whenever the new director comes in, this is a very unique community. And I tell you, when you bring people in that don't really know it, I mean, this relationship with the tribe and the symbiotic things that occur here, it's really beneficial to have people that know this community. But I would just try really hard.
One last question. Andy, who will hire this person?
Based on the statutes for administrative coordinator, or excuse me, county administrator county.
Yep.
I make a recommendation to the board for an appointment, like a recommendation
To the full county
to the
board?
full board, and the board.
Would it
has
go
to-
through this board or no?
It would actually, it's the full county board that would make the.
Okay.
But, I mean, I'll tell you, from the standpoint of how we're doing highway, I've been involved. One or more members of the committee in the interviews, and
Sure.
I mean, I'm not gonna go through the process and. Pick somebody on my own and take them to the board. I wanna make sure I have some committee involvement.
Yep.
I think that's
Thank you.
a smart decision, just like when we hire other employees, we involve the department head. They're a big part of that hiring process.
All right,
I just like to echo what Chris said, what Don said, the importance of having, so we can stay with as long as you can. Like down in the train, so we coming in, but while you here, keep it here with us. And he's right, knowing the community, knowing people, knowing the layout of everything in our county. And with the tribe, the importance of whoever comes in as director, build on that relationship, keep working on things to meet the needs of our people. So I support that too.
we hope we find somebody top notch that can handle the job, and we hope it happens soon. So. Where we at? Hey, do you want to go through any of you want to go through any of the other departments?
I think we have some of the people either on the phone or. So I don't think we have anybody from adult long-term care though, do we?
No, but there is a report
Yep.
in the packet that Sarah has submitted.
Okay,
For your review.
Alicia is on for behavioral health if you'd like her on.
go ahead. Alicia,
Yes, I'm here. I don't know if anybody has any questions. I provided the report.
well, that's fine.
Yeah, Alicia has the report. There's also the mental health cost by client report submitted.
Okay.
Yes, I have a question, Mr. Chairman. How many consumers do we have for like CCS or CST? Are we at capacity or is there still? Can you answer that, Alicia, please?
I can if you can put my screen back up because my memory, there's too many programs I supervise, remember all the numbers. Thank you. Okay, so CCS right now, no, we're not at, we have one service facilitator, and normally a service facilitator takes on between 10 or 12 people. But the problem that we have is, again, a mental health clinician besides Joe. We do have one person through Northland Counseling, and we have one person through Superior Counseling. It's hard to recruit mental health therapists just because of the amount of paperwork that CCS has and all the requirements at 36. I know that we had one applicant, and I'm not sure where that process is with getting a interview set up or not for a mental health therapist. I know we've had that position open for over 2 years. So if we had another in-house therapist, it's much easier for the mental health portion of it, simply because when we contract out with mental health therapists, it's a different type of protocol where I'm doing all the QAing of all their notes. It's just easier to have an in-house therapist than contract out, but if we have to contract out, that's what we have to do. CLTS, we have 46, which just in the last 2 days, we have another 2 people going on there. We have a lot of high cost renovations going on right now, 5. We're seeing a lot of people move into the community with children that are autistic and have greater needs than we've seen before in the last 3 to 4 years. So Ruth Ann and Terry are doing the best that they can do with the caseload that they've got and all of these high cost renovations or modifications to the home. CST, that's ongoing, not many issues there because they don't have the requirements like CCS or CLTS does. So that's CST is, we're doing well with that. We have our coordinated services team meeting tomorrow. That Zoom link and agenda was sent out. We're doing it in the assembly room tomorrow and via Zoom if people can attend in person. OWIs keep coming in. That's about it.
Thank you, Alicia.
that
Sure.
covers it.
And Andy, didn't the governor put a lot more money in his budget for mental health? And are we gonna be able to get some of that money, maybe to recruit someone?
Well,
And do we have an applicant, did I hear?
yeah, there has been a mental health therapist applicant. I think there's been a couple applicants, one's been weeded out. I don't know where the if the interview's been scheduled with the other applicant, or where we're at with that. To your first part of your question, that's the definition of a loaded question, because, yeah, the governor has put a lot of funding in his budget for mental health. I think he's declared 2023 as the year of mental health. But at this point, that's the governor's budget and won't be the budget that's adopted. Legislature hasn't introduced their budget. They've acknowledged that there's a lot of mental health needs, but and I should say in the governor's budget, it is providing additional funding to some of the programs that the county provides. But you're not gonna know the answer to the question until June, hopefully.
Right now, between the legislature and the governor, we can only hope that they come to some agreement and spread that, some of that surplus out over the county, country, the state, and further develop some of our programs. So that's just a wait and see thing.
And I just anecdotally add, Joe has been talking to myself and Paul, and we've got one person coming out of the institution that potentially is coming back to the county that could be a high cost placement. And there's more, maybe another one after that. And then we do have a youth going into a placement as well, not for mental health, but in the youth justice area. But those are both higher cost placements than we would like to have. We're trying to, I guess, address it and find out what's the best solution for the consumer, but also the county as well. And the state's involved with the one that Joe's been working on.
Okay. Anybody else? All right. We've got the reports, but are there any specific questions on any of the remaining?
Andy, you were gonna speak on child protective services?
I'll speak on that. So I don't know if this is what Mr. Pettit was referring to, but we are definitely encountering some difficulty in CPS. So I think at the county board meeting, I had mentioned that we had 2 resignations the week of the board meeting. So that means we've had 4 resignations in the last 6 months, probably 5 months. So we had 2 vacancies before the end of 2022 that we've been trying to fill. We've seen a couple applicants, but haven't been able to convert them into hires. And then now we have 2 more that they gave us 2 weeks notice, and they have vacated as well. So there's been a fair amount of activity there with the staff to fill in the gaps until we can make some hires. I should say also, we did last week we had an LTE person that we had been able to hire that was a retired social worker that was in the area. But they've decided to leave the position as well. So right now we're down to Carla and the social service aide. So the call went out to the counties in the region. And so we were able to get some help from various counties for various things. So there's some counties taking the phone calls a couple days a week to do the access work. And some counties volunteer to do screenings and a kinship, foster care, certification process for that. So we're working through that, but we're making some additional changes to rebuild the department, and also by the end of the week, we'll have a couple of people under contract to provide contracting services to keep that unit covered. But it's going to be a tough go of it, especially when we get into the on-call rotation and having the boots on the ground people. They meet with do the work within the county. A lot of the help we're going to be getting is remote through those other counties or service providers. So we have
Andy and Patty, this must be a mandated service, I would guess.
yes.
Child protective
So
services.
we're not meeting that mandate right now, are we?
We'll meet it by contracting, or we're on contracts in with other counties to fill in the gaps. But it makes it a much more cumbersome process. This is also the unit that works with the Indian Child Welfare.
Right.
For those placements, so, and we made the tribe aware of where we're at, and it's gonna be a tough go of it until, there again, though, we have looked at the wages. We think they're competitive, we have some flexibility with them. The employees that are leaving, we have met with all of them, some of them multiple times to get a little better understanding.
Exit interviews?
Yeah, we did exits. I mean, we had talked to them because we knew this was a possibility, and then did exit interviews. I can't put a finger on any one thing that everybody's leaving for. Some are leaving the profession, and they're not going to another county to be a CPS report, so that. Some are going to other counties that are closer to home. Nobody has said specifically it's the wage, but I'm sure that's part of their factors when they look at other employment. The nature of the job, it's a difficult job. It's probably, I don't know if I'd say it's the most taxing on an employee here, but it's certainly up there. Just the difficulty of the situations they're in and the clients they work with. So I think those things are all factors. So yeah, we're taking that into account as we move ahead. And I mean, this is, I want to use a sports analogy, but in my head it is. It's like we're rebuilding. We're in rebuilding mode right now to restaff the department. And the employees we had, I mean, this isn't like we lost these 4. I would say we lost these 4 in the last 6 months, but this has been a kind of a cycle over the last 5 years where we get staff in and they make it a couple of years or a year, and then they move on.
Right.
Do you work closely with the university?
You know,
Does they have programming?
well, but as far as like.
Yeah, for the students when they have the.
Yeah, we've done that, and we also,
Gauge them.
I say, we talked to the state for any help there. They were not very helpful, but they brought up like we don't have to hire certified social workers. We can hire.
I'm talking LCO University,
And LCO, we work closer with Stout for training.
but we have students out there that are going in this field. And they reach a certain point in their education that they need to get out there and get that experience, you know. It'd be good to have that relationship there. So we can tie into those students who are coming up now and who are getting educated, and so they get that experience and it can help us. I mean, it's something we want to keep building on.
Lorraine, your human services program that you have out there that has, I know the bachelor's program has an internship. Do you know where those internships have been served?
I know they're expanding, so.
Because I know there is a
Yeah.
bachelor's
Yep.
program out there, because that could be something that maybe we would want to look at.
Yeah, I would encourage that, because we have students who are attending. And they need that.
I mean, we have other internships in health and human services.
Yeah.
So it would be something to
Yes,
to
yeah,
take a look at.
yeah. Yeah. Yeah.
Yes, thank you for those comments.
I have my hand raised before Ms. Schuman even started speaking. But I work at the college. I'm the academic administrative assistant to the provost. So if you want to know about programs out at the college, I would be able to facilitate that.
Good.
My thing with CPS is there any way, obviously there is no individuals out at the clinic that hold the positions that Joe or any of the social workers have held. So is there any way that we can work together, employ individuals through the county and the tribe that work interchangeably to help all the constituents of Sawyer County? It's obvious that this is a very stressful field. People come in, they end up doing more work than they were even told was going to be there because of the high turnover. It is most definitely the salary. It is most definitely the environment. It's a thankless job, and at times very depressing job. If you've ever had to be a foster parent or someone that sits and has to attest for the children. But has become, if a child dies, besides what's already happened out at Ameriview or any place else that we are placing individuals, or individuals are going to place by a sex predator or someone that's off their medication or someone that's on a drug frenzy, what are we going to do, ladies and gentlemen? We have to do something. We have to figure out how to staff positions, and we have to figure out a way around it or to work it, because it's obviously it's not working. The tribe, there's a need out at the tribe. There's no one at the tribe that's on call. There's no one at the clinic that's on call. There's not a social worker that is available, or mental health. You can't tell someone that's having a mental breakdown, you need to talk to a therapist, and you can't get into a therapist for 6 months. It doesn't work. We know it doesn't work. We have 25 almost people that are Native Americans that have died from the age range of 18 to 30 something in the last 2 years. It is not working. How many more people do we have to put into the ground?
Okay, thank you, Ms. Pettit. We all wish that we had the resources and we snap our fingers and solve all these problems, but unfortunately, that's not reality. So we do have to continue working on these problems as best we can. Anybody want to talk on youth justice or economic support? Patty?
Youth justice, you've got the report in front of you.
Okay.
Any questions on that?
All right.
As Andy said, we do have some high costs looming in the future there. And economic support, Shauna is going to speak tonight.
Okay.
I've got the monthly report in your packet. It's the one that I submit every month, so I don't know if there's questions on it or not. Paul had asked me to come just kind of give you an update on what is happening with food share benefits and healthcare, because there's some misinformation out there, I think, especially with healthcare benefits. Of course, the president announced that the public health emergency is ending. So with those changes, the supplemental food share benefits that families were receiving, those ended in February. So what that meant for households is at a minimum, they would receive $95 additional benefits separate of their regular allotment or the maximum benefits for their assistance size. So that is a big change, and it's a big change with the cost of groceries being what they are. I think what I had read was the cost of groceries is 34%, up 34%. So we have seen increase in calls in our consortium call center. We are giving information in our counties on the food pantries. So this is also going to be a hard hit for our community food pantries. Because they probably, I mean, they're still being utilized, but with those supplemental benefits, I think that they're seeing people that maybe are not on food share. the elderly populations. Having that maximum benefit for those households has been huge. Normally they're receiving a benefit that is like $25 a month based on their Social Security income. That's where their allotment is, unless they have high shelter and utility expenses. And they've been receiving over $200 a month. And they've been receiving these supplements for almost 3 years. So I just kind of figured that these types of complaints could come your way too, as Health and Human Services Board members. So I brought information that you guys can have if you would like. I've got cards for the consortium that fit in wallets that have the phone numbers, you know, on where to call and request help. You know, we don't just do eligibility, we also try to help with resources as well. So it's open Monday through Friday, 8 to 4. It's closed on Thursday mornings, but you know, wait times are still pretty good right now, as far as we're able to get through our calls still at a good rate. The second part is the healthcare renewal. So that last paragraph there that states that renewals are still being postponed, but starting April 1st, regular application eligibility will go into effect. So we will request the same verifications. If it's a EVD Medicaid case, elderly, blind, and disabled Medicaid case, we will be looking at assets. The asset verification system will be back up and running. And so we will be requesting those as well to make a determination. With the health emergency ending in May, we will start doing renewals in June. And I think this is the part that the misinformation is out there, that everybody's losing their health care. And everybody's losing it May or June. And that part of things is not true. Renewals will start in June, and it's a rollout process. So there will be cases that are due for renewal in June, but there will be cases that are due for renewal, you know, April 2024. You know, so it just depends on where your case is at for renewal. So obviously it would have been a true disaster if everybody had to be renewed come June. So there is a rollout plan in place. It's still going to mean that over the next year, lots of people are going to lose their healthcare coverage. And the reason to that is when COVID happened, you know, people became unemployed. There was a huge increase in unemployment. And so adults that normally would not be eligible for healthcare benefits became eligible based on their income at that time. And during the pandemic, we could not end healthcare unless a person requested that we end their healthcare, they moved out of state, or they passed away. So that healthcare coverage has been maintained these 3 years. You know, they would be the secondary if you had a job that had, you know, health insurance benefits. Badger Care would still be the secondary coverage. So it is definitely provided healthcare for a lot of people. The income limit for, and I've got that here too, so I'll pass that out here at the end, is extremely low for adults. It's 100% of the federal poverty level. So I know in past Health and Human Services Board meetings, maybe some of you weren't on this board at that time, but I've been asked in the past, you know, I've heard from employers that employees are requesting to only work 25 hours a week so they can keep their health care coverage. And that's the kind of thing that does happen, and it's not against the rules. You know, if you have a healthcare need or you're on a prescription that is costly, that might be a hard decision you have to make is, you know, what kind of income do I earn and yet stay on healthcare? You know, so when employers are talking about, you know, what is going on, you know, my staff, they don't want to work 40 hours. Well, part of that then has to come back on the employer offering insurance. You know, or you run into those situations too, where maybe the employer is only offering benefits at a certain number of hours, but they keep you at 30 and you don't qualify. So I mean, we all hear about the healthcare issues in our country, but I can talk a little bit about what I see, you know, on the Medicaid side of things. So like I said, I do have information. I have the guidelines financially. We have been doing a lot of outreach the state has as far as trying to get this information out on social media. I know that Julia has posted on our public health Facebook, you know, some of these updates. We're encouraging people to, you know, call in and get their case updated so that they do get their letters. We do have cases that prefer to receive their notices by email. So the state chose to go ahead and send the notices by email and by mail. We want to ensure that people know what's coming. And, you know, part of that is just making sure that their case is updated. We have the correct address, we have the correct phone numbers. So lots of different ways to apply and make changes. You can do so by calling the consortium number, access.gov. You can do everything online. They have an app on your phone. It is super swift. I mean, you can take pictures of your pay stubs, upload them, and it is the fastest way we can get verification. Even if you're in my office, I still have to go down and have it scanned for it to go to the case. So someone that has their phone and uses the app, it's like, boom, it's right on there. We still have workers in the office every day. You can have a face-to-face appointment. You can walk in. So we also, I mean, for me, supervising this unit, I know that my staff is going to come under a lot of stress in the up and coming months. So it is a call center based job. For the staff that I have, I do have some staff that are intake and renewal workers, so they are not on the call center all day. But I have 2 full-time workers that are call center agents, so they do spend their day on the call center all day. They sometimes get assigned task of, you know, going through the verifications and updating the case. But if you are on the phone for 7 or 8 hours a day, come June, July, with all these changes and people frantic, because they're not only not experiencing, you know, this loss of, I look at it as income essentially, you know, the food share benefits, but also not having health care. So we're going to do our best to support our staff. We've been trying to do some trainings right now and just, you know, things like de-escalation, you know, not taking things personally. The consortium does a good job that way, I think. So, and I have a really good staff, so I'm lucky that way. Any questions?
So how many people are receiving those services?
So that monthly report gives an idea of the Sawyer County cases. So 1,117 cases for food share, which equates to 1,957 recipients. So, and this was, it's always behind. So this was January. Those food share benefits issued still have some of the supplemental benefits in there. But we've stayed pretty consistent on the number of cases, those Badger Care Plus cases. You may not even see a big drop in them because the way it is it's an open case. So you could have a case which has 2 adults and 3 children. The adults may be found ineligible come this next year, but the children are still eligible. So the case would still be open. So you may not even see on these reports a true reflection of what's happening that way. I can try to get some more detailed reports possibly.
As we continue to come out of the pandemic, everything's on surface.
Yeah.
We're a plan of rolling it out.
You know, and one of the packets for Badger Care, so it says use your benefits to stay healthy, and I don't mean to take up a bunch of time, but you know, one of the things that they're encouraging people to do right now and in this outreach is, you know, be sure you keep up with your care. So schedule an appointment for a checkup, get your vaccines to prevent COVID-19, flu, update your prescriptions and get them refilled. Seek out mental health services for extra support. Go to your urgent care if you are sick or emergency room in crisis. So those are some of the things that they are trying to, you know, prompt people to do while they're covered, making sure that children under the age of 21 get their well visits as well. So.
Okay, thank you very much.
You're welcome.
Good report. Public health,
I would like some of your information.
Okay,
Yeah.
I'll pass it out after. Thank you.
yeah, Julia, you're up.
Not a whole lot. Just a couple changes from my report. The COVID community level has now dropped back down to low. We continue to see that decline in influenza, and we did not see that second jump up. So feeling pretty confident that we've gotten through that season. Really starting to really see more rhinovirus, kind of that runny nose kind of thing. I did have in the report about toxic shock syndrome. It is something that we usually don't see, either 0 to 1 case per year. And we have had, actually, I'm not sure if this is the most updated. I know we've had 5 cases in the since July. So definitely getting information out to the public on that, to the schools, because it is on the teenage girls that 4 of them have been. So we've got information out to all of the schools so that we can make sure that we're educating on that, and out to all of the clinics as well. And then just to kind of lean into what we were talking about with kind of that unwinding of the emergency, I just put in some of the things that we sort of know right now, to kind of watch where things are falling. I think the big thing for the COVID stuff is the vaccinations, the testing, and the treatment is really going to be moving back into more of the insurance medical field versus the government kind of paying and giving out tests and paying for things. So it's going to be just like any other treatment we would be getting. So that's kind of one of the big changes. We did start our resource directory with a soft opening. So if you get a chance, click on that link, take a look at some of the resources that are in there. Those resources are to be really health and wellness resources. They're to be connecting people. Also, like ski clubs and, you know, connecting on book clubs. We want it to be kind of more of a wellness type of thing and not just about the healthcare that you'll seek out. There's also events in there, and we're going to be especially working with LCO. Actually, we're going to be trying to get all the events that are scheduled in there and any other educational events in there. So it'll be kind of a one-stop place for people to go. And then I think really the final thing was with the food share ending, or the benefits ending, or the changes, extra benefits. We didn't put that in there as well. So Shauna and I worked through that and got that out. So that's, I think, pretty much it for updates.
Thank you.
I got a question, Julia.
Mhm.
Are you still working on uses of the opioid money then? Is that gonna come soon? I know you're working on a big plan for that.
Yes,
And there's more money, right, Andy, coming?
yes. So actually I just showed Andy a template of what we're doing. When it comes to the opioid funding, we have looked at prevention, harm reduction, treatment and recovery. Kind of mapped out all of the evidence-based strategies that we have in place or that we need to put into place. And then we're going to be putting dollars to each of those and then create a work plan with a Gantt chart, which you're not going to really be able to see because it's pretty tiny, but it'll go over time on what we anticipate we can do and kind of look forward to some things that might be some bigger projects as well, but really needing to spend some time so we have somebody that's always coordinating and moving the projects forward. So that should be, I'm going to meet with Andy on Friday, and we should have a pretty good handle on where we're at with potential funding and where we can go.
Good.
Go ahead.
Yeah, Elaine,
Me? Okay.
no, yeah.
Julia, with putting all these projects in place, is your staff gonna be able to handle this? I can't see it happening.
Yeah, well, and actually I did just lose a nurse. I should have said that. So she moved, she's moving to Arizona. So we're having her kind of help us on a limited term. So we will be hiring for parts of her job. We have some contact tracers that have stayed on with us in a limited term, as in limited term employees. And so we've gotten some grant funding along the way. We'll need to look at, really what it's going to take to invest into these projects, maybe contracting for services. Sometimes it's easier to do that than to hire an employee.
Right, and that will be written into the plan.
Yep.
that's submitted.
Yeah, yeah.
Andy,
Yeah, just was gonna follow up on what Mr. Schuman said. So the monies we already knew about for the opioid settlement from the distributors that have settled, and now there's a settlement coming through from the retailers, so like the Walgreens and the CVS's and Walmart. So that settlement is going through the admin committee this week and to the county board the week after. We don't have a definitive dollar amount of how much Sawyer County is going to get, but they've given us a range of 50 to 75% more than we already had. So I think I gave Julie like a target number of 40,000.
40, yeah, 40, between 40 and 50 per year.
Yeah. Is what we anticipate having available opioid monies for the next
10 years.
15 years. We know the distributor settlement was 16 years spread out. We don't know the spread out for the retailers.
So hearing that, that's not a lot of money.
No, I think
So I was going to this is a systems approach, and what we're doing is not that we're going to be doing all of that. We really need to coordinate all of the services throughout the county to be able to work as a systems approach to make this happen. So
Yeah.
And there's some competitive funds. I haven't
Yes.
kept up on where those
some
are.
of the grants, we'll have to keep watching. One of the things I did mention at another, not this meeting, but on another meeting, coalitions. So there tend to be some funding that comes through for prevention coalitions. And you have to have like a lot of things all set in place. LCO has had a prevention coalition. Sawyer County had a prevention coalition. We're actually working to merge our coalitions together. I think it might be next Friday or sometime in March. We have a all-day work day to be able to combine that, create the plan, make sure we have all the sectors represented. There's a lot of things that need to go into those to make sure you're following evidence-based practices, and then you can be eligible for funding. There's other funding streams we'll be watching for that could be coming into law enforcement, the jails, health and human services. We'll want to be watching for these grant dollars because the state is also getting opioid settlement funds. They are turning around that funding and putting it into grants. In fact, there's just one that just came through for a vending machine for Narcan. So And we did just get we just got the official notice that we did get the Narcan grant, so we'll also be able to do education and community distribution as well. So it'll be Bezuki, North Lakes and us. Yes.
Another question. Do you have anyone that has the time to sit and write all these grants? Because that's the way it's gonna go.
Well,
And that takes a lot of
and
time.
actually, we have, last month I reported out that we have 1.5 AmeriCorps members with us. And the one AmeriCorps member as part in her job, she's able to do grant writing and fundraising. So we do have somebody that can step up. And we have trained another person on grant writing, and we'll probably be reaching out to our volunteers who have had experience in grant writing as well.
Well, there again, I thought of the college universities, the students that are in that area. I mean, that would be like part of their internship.
Mhm, mhm.
And
Actually, we are send people to grant writing
Okay.
training
Good.
from the university. It's a good class.
So I'm sorry, one more, Julie. So is this money gonna be rehabilitation or prevention or both?
So where we're finding where we really need to spend the resources and get the biggest bang for our buck is probably on the prevention and then creating a safe recovery network for people to come back to, because we can send people to treatment all we want. And if they're coming back to an environment that's not healthy, they don't have safe housing, they don't have a good work or employment and things, then they're just going to go right back to couch surfing and using again. So focusing more, and harm reduction is not that expensive to do. We can put that into place. Treatment is really expensive to do. We're going to need to figure out how to send out. There's no way we'll get treatment centers here and be able to staff those, but we can create a safe recovery network for people to come back to.
It would be nice to have some money to put into recruitment and retention.
Right.
and development of providers to
Joe?
treat these individuals.
I just actually marked that down as one of the things, because there are specific things we can spend the money on. And can we do incentives, maybe tuition reimbursement, something like that, that we could, but again, 40 to 50,000 a year.
Yeah.
Okay, any more questions on public health?
Okay.
Okay, Patty, you wanna-
Thank you.
Fiscal, you have the budget performance report for January. And also the purchase service report, it said March, but it's January. Purchase service recap. In the fiscal unit, we also lost a long-term employee who gave notice. They're going to be staying with us through the recordings of the year, but we're in the midst of advertising and hiring for replacement for that position also.
Okay. Any other questions? Okay, future agenda items.
Recruitment, sounds like.
Yeah.
Well, we want
I
to,
mean, we really can't do anything, and Andy's right, until they do announce when they're gonna retire, right? It's hard, you can't really bridge that gap and put someone in place before they retire, so. But we've got a lot of retirements we're looking forward towards, I guess, Andy, and we gotta be prepared.
Yeah, I mean, we know, all the ones we talked about retirements tonight, we knew they were coming. Just didn't,
No when.
some we get 30 days. A couple, actually, human services, they're giving us at least 2 months, and Patty's area, that one is 4 months. Patty said we're making plans on how to fill that position. Beyond human services, we're gonna have some more retirements in other departments this year.
Andy, I have a question. Do you anticipate job description changes or anything? Can we prepare all those kinds of things so that when the proposal goes out for new employees, everything's in place and it just starts right away?
In some jobs, yes, some jobs, no. Like for the most part, human services, that the executive director position, there wasn't a lot of change,
Okay.
a lot of technical changes to that, and maybe more in how we're pitching the job. And that's like, just maybe adding in some things about some remote work opportunities as part of the job, or the way the workplace has changed, we're including that in some of the jobs where it's makes sense. And every time we do have an opening, we do just take a look at, okay, do we want to fill this in the same way the position was, or is there a realignment of duties, or is there ways to contract for the work? So we do assess that. Right now, though, there's not a lot of changes that are occurring in the position we're talking about.
Thank you.
Okay, correspondence, reports on conference. Which one of you gentlemen would like to do it? Okay, well, no, I guess that wasn't a health and human services conference. Never mind, I'm sorry.
Thank you.
We're adjourned.